Hello everyone, I am a gynecologist and obstetrician. Today we will be discussing about 20 scary facts about bacterial vaginosis. So if you are interested in knowing more about bacterial vaginosis, then this is the video for you. So let's get started. First of all, what is bacterial vaginosis? Well, bacterial vaginosis is a condition where there is an overgrowth of certain bacteria in the vagina. The vagina has a normal flora of lactobacillus. That means there are certain good bacteria which stay in the vagina. But sometimes there can be an overgrowth of other types of bacteria that are not so good for the vagina. And when this happens, you can develop symptoms like vaginal discharge, unpleasant vaginal odor, and discomfort around the vulva. Now coming to the first fact. Fact number 1. Bacterial vaginosis is the most common vaginal infection. It affects 1 out of every 3 women during their lifetime. This makes it the most common vaginal infection. Fact number 2. Bacterial vaginosis can lead to serious complications during pregnancy. If left untreated, it can cause premature labour, low birth weight babies, and increased risk of transmission of HIV to the baby from the mother. So if you are pregnant and you have bacterial vaginosis, you should definitely treat it because it can lead to serious complications for both mother and the baby. Fact number 3. Bacterial vaginosis is caused by an imbalance in the vaginal microbiome. The vaginal microbiome refers to the community of bacteria that live in the vagina. When the balance of these bacteria is disrupted, it can lead to the growth of harmful bacteria and development of bacterial vaginosis. Fact number 4. Bacterial vaginosis is not caused by a lack of hygiene. Many people think that bacterial vaginosis is caused by poor hygiene, but this is not true. In fact, overwashing the vagina can make bacterial vaginosis worse. The normal flora of the vagina helps to protect it from infections. So when you wash your vagina too much, you can strip it of its normal flora and make it more susceptible to bacterial vaginosis. Fact number 5. Bacterial vaginosis is not caused by sexual activity, but it can be spread through sexual intercourse. Bacterial vaginosis is not an STD or an STI. This means that you don't get bacterial vaginosis from having sex with an infected person. However, it can be spread during sexual intercourse if the person is a carrier of the bacteria that causes bacterial vaginosis. Also, using barrier contraception methods like condoms can reduce the risk of spreading bacterial vaginosis. Fact number 6. Bacterial vaginosis can be passed from mother to child during childbirth. If a woman has bacterial vaginosis during pregnancy, there is a chance that the baby can acquire the infection during vaginal delivery. This is why it is important for pregnant women to get tested for bacterial vaginosis and treated if necessary. Fact number 7. Douching the vagina can increase the risk of developing bacterial vaginosis. Douching is a practice of washing the vagina with water or other liquids to clean it. However, douching can actually make bacterial vaginosis worse. As I said before, douching can remove the normal flora of the vagina and make it more susceptible to bacterial vaginosis. Fact number 8. Bacterial vaginosis can cause pelvic inflammatory disease. Pelvic inflammatory disease is an infection of the female reproductive organs. It can cause severe pain, fever, and in some cases infertility. If bacterial vaginosis is left untreated, it can lead to pelvic inflammatory disease. Fact number 9. Bacterial vaginosis is often asymptomatic, meaning that many women who have it do not experience any symptoms. Some women may experience mild symptoms, while others may experience no symptoms at all. This is why it is important to get tested for bacterial vaginosis if you are at risk for it. Fact number 10. Bacterial vaginosis can make other vaginal infections worse. If you have bacterial vaginosis and another vaginal infection at the same time, bacterial vaginosis can make the other infection worse. For example, if you have bacterial vaginosis and a yeast infection at the same time, bacterial vaginosis can make the yeast infection worse. Fact number 11. Bacterial vaginosis is often diagnosed with a pelvic exam. During a pelvic exam, a healthcare provider will insert a speculum into the vagina to visualize its walls. They will also use a swab to collect a sample of vaginal fluid for testing. The sample will be examined under a microscope to look for the presence of bacteria. Fact number 12. Bacterial vaginosis is treated with antibiotics. Antibiotics are used to kill the bacteria that causes bacterial vaginosis. The most common type of antibiotic used to treat bacterial vaginosis is called metronidazole. Metronidazole is available as a tablet or a gel that is inserted into the vagina. Fact number 13. Bacterial vaginosis can come back even after treatment. Some studies say that up to 40% of women who are treated for bacterial vaginosis will have it come back within 12 months of treatment. This is why it is important to practice good vaginal health habits, such as not douching, wearing breathable underwear and practicing safe sex. Fact number 14. Bacterial vaginosis is associated with an increased risk of sexually transmitted infections. When the balance of bacteria in the vagina is disrupted, it can make it easier for other bacteria and viruses to enter the body. This can lead to an increased risk of getting an STD or an STI. For example, women who have bacterial vaginosis are at a higher risk of getting HIV. Fact number 15. Bacterial vaginosis can cause pain during sex. The discomfort and inflammation caused by bacterial vaginosis can lead to pain during sexual intercourse. This can be very frustrating and upsetting for women who suffer from bacterial vaginosis. Fact number 16. Bacterial vaginosis can cause itching and irritation in the vaginal area. The abnormal bacteria that grow in the vagina when you have bacterial vaginosis can cause irritation and itching in the vaginal area. This can be uncomfortable and annoying, but it is important not to scratch the area as this can make things worse. Fact number 17. Bacterial vaginosis can cause changes in the vaginal discharge. The type and amount of vaginal discharge can change when you have bacterial vaginosis. You may notice that the discharge is more abundant or that it has an unpleasant smell. These changes in vaginal discharge are due to the overgrowth of bacteria in the vagina. Fact number 18. Bacterial vaginosis is not a one-time thing. Once you've had bacterial vaginosis, you are at an increased risk of developing it again in the future. This is why it is important to practice good vaginal health habits and see your healthcare provider regularly. Fact number 19. Bacterial vaginosis is more common in women who use tampons. Women who use tampons are at an increased risk of developing bacterial vaginosis. This is because tampons can absorb the normal bacteria in the vagina, leading to an overgrowth of other bacteria. Fact number 20. Bacterial vaginosis is not dangerous, but it needs to be treated. Although bacterial vaginosis is not life-threatening, it can cause a lot of discomfort and problems if left untreated. It is important to see your healthcare provider if you think you may have bacterial vaginosis so that you can get the treatment you need. So these were the 20 scary facts about bacterial vaginosis. I hope you found this video informative and helpful. If you did, please don't forget to like, share and subscribe. And if you have any questions or comments, please don't forget to leave them below. Thank you for watching and I will see you in my next video.